Welcome back. Let's Get Physical Therapy is an educational podcast brought to you by MedStar Health and hosted by me, physical therapist Becca Schumer. I will be sharing the mic with tons of healthcare professionals with the goal of educating and inspiring fellow PTs and future PTs. We hope you find this both informative and inspirational, ultimately optimizing how we treat our patients and grow as professionals. Please enjoy today's episode. Today on the podcast, we're joined by Karen Postl. She began her professional career as a physical therapist in the United States Army Medical Specialist Corps. She was a PT in the military for over 5 years, working across all services with retirees and dependents. She gained invaluable experience as a staff PT, as the assistant director of rehab, and as medical specialist program recruiter. Karen continued her career at MedStar Health Physical Therapy as a regional director in Southern Maryland. In addition, Karen transitioned to the Army National Guard as a PT and then on to medical company commander. Karen moved from Maryland and worked across many different practice settings, working with adults, pediatrics, geriatrics, and even active duty Navy divers. Karen then returned to Maryland and to MedStar Health a few years ago, where she was delighted to step back into a leadership role as regional director in Southern Maryland. Karen and her team have been able to be involved in creating a multi-service care team at one of her sites, working with local high schools, community centers, and bringing additional clinical services to the Southern Maryland community. Karen is passionate about giving the best care to her patients and the community that MedStar Health PT serves. She has been involved in resiliency training and stress management at the regional level. Karen has also collaborated on the development of a robust leadership training series, as well as spearheading the Aspiring Leader Mentorship Program, Molding the Future of Healthcare. We are excited to host Karen today, and let's jump in. Karen, welcome to the podcast. I'm so happy to have you today. How's it going?
Yeah, it's a pleasure to be here, Rebecca. Thank you for inviting me.
It's May, which is Mental Health Awareness Month, and we have this amazing platform. So I wanted to bring on a couple of professionals to talk about mental health within our own profession, how it impacts our patient care. And then we have also got some docs coming on to talk about more like the nitty-gritty diagnoses. So I'm excited to have you on today to jump into how we talk about mental health within our own profession. Happy to have you.
Thank you. I think it's a really important topic that we discuss, and we have it out there in our profession, not just in physical therapy, but in the medical field in general. So I'm really excited that you're highlighting this and kind of just broadcasting for everybody to learn from it and just talk about it.
Thank you. We like to start our episodes asking, I just love hearing people's stories. So I want to know, why did you choose physical therapy? How'd you get involved in the field?
It's a long history. I actually knew I wanted to be a physical therapist when I was about 13 years old. I went to observe with my father, actually, at a PT. Prior to that, I actually loved giving massages. So that's where I was generally trending. So I did a lot of volunteer work through high school and just really fell in love with the profession, particularly actually with geriatrics. Went to college. I got my graduate degree. And then I actually did ROTC in college. That was another dual career goal of mine, and went right into the military active duty. So definitely away from the geriatric population, but got to work with athletes and prior service retirees and the whole gamut. And then I found myself at NRH, previously NRH, now MedStar Physical Therapy. Just was such an incredible environment, combining a lot of my interests and loves with the athletes, with the chronics, with chronic pain patients, with neuropopulation, just the spectrum of what we do at MedStar, just incredibly diverse patient population, really was interesting. And also meeting our soon-to-be retired VP, John Brickley, and his vision is just, it's an incredible place to still work to this day. So that's how I evolved to MedStar. So I've been a PT for about 22 years, yikes. Have worked in pretty much every practice pattern you could think about, not just outpatient, but I've done inpatient, I've done skilled nursing, not home care. That was the only thing that I haven't done. It's been quite a journey.
Yeah, I don't want to go down this tangent, but I know oftentimes as clinicians or as students are graduating, they're like, I got to jump into sports right away, not realizing the importance of like all the other areas. So I think it's cool that you've done all of that. I too started an inpatient, and it was an invaluable experience. Don't regret it.
I think it gives you so much perspective. And I had the amazing pleasure in the military to work side by side with other professionals as well, even chiropractors. And I think it just gives you a lot more insight. And that's really where our field is going, right? One body, whole person. So I think the more that you can pick up along the way, whether it is through your professional life or your personal life, it just makes you a stronger therapist and advocate for health in general.
That's a lovely segue into our topic because talking about the whole person, and we're hearing more and more about mental health and people talking about their own personal struggles. So I want to dive into the topic of mental health. What does that even mean? I don't know about you, but in school, I wasn't really taught how to deal with these things. It was just kind of assumed that we would pick that up as we go along. So, why mental health? Why is this so important?
You are correct. In school, we don't really talk about mental health. I think once you get into the profession, you start that education and that evolves through time. But it's, as you said, we pick it up along the way. Mental health to me and to us should be extremely important. We are a whole person. It is a part of who we are, not only in physical therapy and the rehab process, but just as people in general. I tell my team members all the time, like, we cannot give fully to our patients until we give fully to ourselves and to our family, so the components of our life. So it's extremely important. It always has been. My personal history, I have a sister who works in the mental health field, and I think that has been really, really wonderful for me to bounce things off of her and learn through her knowledge and then look into it on my own. And then, of course, I think most recently with COVID, it's kind of come to a real helm, right? It's really, really important that we givers, caregivers, make sure that we can continue to give. And some of that came through, like I said, my sister in the mental health field, my background in the military. I was active duty for about 10 years, and then I segued into the National Guard. And the National Guard not only has the federal mission of going overseas, like the active duty, but we have state missions. And those missions usually are times of emergencies. So in this area, hurricanes, blizzards, and my husband supported the COVID vaccinations. So in those very stressful times, so we do a lot of training in the military for that as well. So I have been able to bring some of that knowledge and that experience into my professional field as a PT.
Pre-COVID, we were just running, like go, go, go. And then once COVID hit and we were stripped of our stress relievers and the things that bring us joy, we're all sort of bare. Where do we go? How do we cope with this? And I know there was a uptick of mental health issues going on, and definitely access to mental health became a much bigger thing. So I think it's important for us to individually like understand what helps us deal with stressors in life, because when we're in front of patients, it's their time to connect with us, to tell us their story. And if we're so bogged down with our own internal things going on, then we can't give our undivided attention to our patient.
I think too, what COVID simultaneously provided us was, for many of us, moments to reflect, right? To look into ourselves and at our lives and really look at, just in general, our relationships with ourselves, with others, and what we derive, I wouldn't say pleasure from, but what we really find meaningful in our lives. So for many, and then with us in the health field, while we had time to do that, we also had to have time for our patients and to continue the go. So I think everybody had lots of different stressors in the past couple of years, but for those who simultaneously worked, not just in the healthcare field, but also had that time to reflect, I think it's just that, like you said, that duality in the past couple of years that everybody's had to deal with. So I tell people one of the positives that can come out of COVID is just moving forward within our own selves. So, and that's always a challenge, but it's given us pause and really make sure that we have allowed us to have a different balance than we had before.
You had mentioned that we are givers as PTs, and we need to have compassion for ourselves and how we take care of ourselves. What does that even mean?
Well, I think you can't have compassion without resiliency. I think that's step one. We at MedStar, we've created this leaders training separate from COVID. It was our own internal goals prior to COVID, and we were able to continue to develop those goals in our environment of learning. And that was one of the first discussion we had is resiliency. And I think that's even more important than self-compassion, because you have to identify the fact that we have to deal with change. But that doesn't mean that we always have the right answer. So then that begets self-compassion. I say just give yourself some grace. We're not going to do it right every single time. But yeah, so I'm not directly answering your question about that. But to me, self-compassion is being okay with not being okay sometimes, being okay with not having the answer all the time, and owning that and being honest with that. Just like with our patients, we say, this is my skill set and this is what we can do. And that might not be what ultimately is the winning combination for you. And then, oh, by the way, Rebecca has these skill sets. So that's kind of the same thing, just having that compassion with ourselves emotionally and even professionally to say, I don't know it all. And then also saying, how can I get it all? Whether it's self-reflection, whether it's asking for help, whether it's leaning on other people. I don't know if I directly answered your question.
No, and we can't be experts at everything. And that's kind of the cool thing about PT is that there's PTs that specialize in everything and not beating ourselves up because we don't know everything and being honest with our patient, saying, I don't have this tool and I can help you find the person that does.
And having those resources to say, I know I can get this for you, whether they're inside our network like MedStar or outside the network, just knowing your community resources. And that has to do with mental health as well. It's not just physically with our patients. A lot of times we'll have patients with other challenges. And it's important that we acknowledge those challenges and have a conversation with them and find the resources that they need to, because sometimes we are a little bit of a counselor, right? With our patients and with ourselves, with each other, right? As team members, I tell team members, it's okay to have a stressful day and to talk to each other. When it becomes not okay is when we just focus on the negative. At that point, we need to do something else for ourselves, or sometimes it's process changes. It's just being honest with the whole team and saying, this isn't working, what can we do to make this different or better?
Yeah, I want to talk more about the whole team and resilience in a bit, but I want to get into more, how do we as clinicians identify our own stressors? What helps us? How do we build this toolbox of identifying what works for us and what doesn't work for us so that we can be more present?
There's a lot out there, I have to say. Some of it is just looking on your own, how do I de-stress? That's the biggest thing, is we have proactive behavior and reactive behavior. And reactive is like, I'm stressed, now what do I do? So that's one way to deal with it. But that's just a patch. That's like putting a Band-Aid on the cut. The proactive really is just getting the correct treatment, put a little salve on there and allowing that cut to heal. So that's what I look at, proactive behavior. And so it's like, before I get to that stressful point, what can I do to create in my life the best way that I can deal with things? So that's where that's what we talk about, resiliency, is being able to deal with change effectively. So I don't have the exact answer for that. It's very individual, but I think putting yourself in a situation or surrounding yourself with people who have different techniques, or being open to other techniques. I know it sounds ridiculous, but like some little 5-minute exercises, breathing exercises, or the guided meditation. It's just like basically pushing yourself out of your comfort zone sometimes and saying, maybe this will work. I have a personal story, which is kind of crazy, but like, I have actually been resistant to listening to podcasts because I just want to like let loose and relax in the car, right? Just like, oh, and I finally said I'm going to do it, partially because of this podcast. And it's been awesome, and at sometimes cathartic, just to focus on something mentally other than work, or in addition to work, so that's my own personal aha moment for the past 2 months. I really didn't think it was going to be as restful and filling my cup up again as I thought it was going to be, and it has. So yeah, I'm a good example of going outside my comfort zone. It's like, nope, I'm going to do it. And now I'm like, oh, well, maybe I can listen to this podcast, and maybe I can listen to this podcast. So it's just another way that we can give to ourselves.
I love that. I don't know if you're up to listening at 1.5 speed. I've gotten to that point. So then when I listen to this podcast back in real time, I feel like I'm talking in slow motion.
That's funny. I'm not there yet. Give me a
Okay.
couple of months.
But I also think it's valuable to take personality tests or like Myers-Briggs. Just we
100%.
have to kind of dive in and get to the nitty-gritty of our values, our morals, who we are as people, or else we won't be able to figure out what can help ourselves in stressful situations.
Absolutely. And that's whenever in the past, when I've ever interviewed for a job, I always ask those questions. Like, do you take time to have clinic meetings? What do you do in those clinic meetings? It's really important. If you're not doing those in your own clinic meeting, ask your director. Like, it's an ask. And I do some onboard training for MedStar health physical therapy. And that's the same message that I have for them. Like, if some of the things that we're doing resonate with you, is ask the question. And I think the personality tests are incredible. Every time I do a personality test, even if it's the same exact one, I learn more of myself, mostly because of the discussions that we have with other people. So there's lots of fun ways to do, the color personality, the Myers-Briggs, the Big Five personality. I think people go right towards like conflict resolution, right? Like, how can I get to that? And that's step 10 or 5 or 10, whatever step you want to say. I think the most important thing is to drum it down to the basics and like get to know who I am, because I can't get to know other people unless I really know what makes me tick. And then I can say, hey, in a conversation, that's a great idea. That makes you tick as far as feedback or processes or whatever. But I think this is really what helps me. And maybe we can find something in there.
Have you heard of the Enneagram?
Oh, what's that?
It's another personality test, and it's one I've gotten into more recently, and it's really cool because there's so much on it now that they identify ways that, like, I'm a 1. So if I am in conflict, how can people best help me, or how can I best help myself in certain situations? And every time I see a post about an Enneagram 1, I feel very called out, because it's sort of, it's not like cheesy like a horoscope can be, but it really is helpful in just learning about myself. And because again, like we know what we know, we don't know what we don't know. So by reading these things that identify like these are good ways to deal with stress, and maybe I would not have tried one of those because it seems silly to me, but like you trying the podcast, you never know what's going to work for you until you give it a chance.
That's awesome. You have to share that with me. That's the Big Five personality test drums it down to the basic core. It's fantastic. The Myers-Briggs, they have the freebie version, and then they have the one you can purchase, the freebie version. They have on the actual website, they'll have like you in the clinic, what you in the workplace, you at home. So it gleans some insight on that. But yeah, I think any amount of that you can do. And a husband started taking the Big Five personality for a course that he's doing his master's degrees, and he had never seen that before. He kind of did what you did, like, this is awesome. And he convinced like 5 of his coworkers to take it. And then they had a chat. It had nothing to do with the director or anything. It was just like, hey, let's find out about each other. And it's great to do.
I'm really like itching to talk about the team aspect of mental health, but I'm holding off because I want to talk about work-life balance. We all hear about having balance in our lives. I'm air quoting, you can't see me, but what does it mean to have work-life balance, and what does that look like for you?
To me, to have work-life balance is that I am able to give to my family and to my work family. I call them my family. They really are, equally. And that doesn't mean give my 100% all the time. years ago when I started at MedStar Health Physical Therapy, I was a clinic director and a regional director, and I didn't have that balance, and I could tell that in myself. It was like you said earlier, go, 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 give, give, give. I didn't have a family at that time. I had my husband, who pretty much is self-sustaining, but I could see that in myself, that I needed to get that balance before I started my family, and it just came from years of reflecting and saying, like, how can I make this work? And some of it is a support system, right? Having the right people on both teams, both families, if you will. And then some of it's just being okay, like I said earlier, with not having the answer, not doing everything all the time correct, just being okay with that. So some of it's just your own personal comfort, being able to tell people, this is what I can do now, and being right with that. And sometimes it ebbs and flows. Sometimes my work overflows and I have to give more to my work than I can give to my family. And that's when I fall back on my family at home, my support system. And vice versa. Sometimes my family, sickness happens and you have to be okay with that. So I have to be okay with telling my work family, this is my limit right now. And then I think the biggest thing too is creating a support family on both sides that understands this and is okay with that. That's probably, to me, the most difficult thing in it is creating in a team, is just that, to be okay that we all are imperfect.
I hear you talking about boundaries, it sounds like.
Yes,
It's
yes, I
important to
do.
have boundaries.
And that's different for everybody.
Sure.
Some people say, I'm not going to do work outside of work. Some people, like for myself as a manager, I want to be accessible to my team members in different ways. They know I'm not going to jump on their request right away, but acknowledging that whatever they're coming to me for. So that's important to me, but that might not be what somebody else needs. So telling people, like setting boundaries and saying, this is what I can provide for you, and being understanding that that's going to change at 100%. Like during the holidays, it's really stressful. We have short work weeks. I have to be there in a different capacity for my team than I would be, in the middle of, say, March.
And setting those boundaries and verbalizing those, I feel like feels respect, because if you're telling me these things and I value you as a person and I care about you, then I'm going to value your boundaries and respect those. And with that said, like if something emergency happens and I happen to reach out to you this one time at this off hour, it's serious because I respect your boundaries and I wouldn't do it if it wasn't really, really serious.
Correct.
Yeah. We talk about like work-life balance, and that's not a permanent place. It fluctuates, it changes, as you said, depending on the seasons. I think it depends on the season of life. As a new grad, or you say yes to everything, like you have more time, you have less responsibilities. I mean, we have bills to pay, I get it, but you want to experience everything. And then as you get older, I know for myself, I know what brings me joy. Like I know what I value more. I respect my time a lot more. So I'm more comfortable saying no because I've found my niche. All to say it just kind of ebbs and flows, and that balance is never truly a balance.
I think one of the hardest things as being a caregiver is we want to give care. So it's really just saying no sometimes. A patient can say, I can only come at 6, but I only work till 5. Saying I can do that once a week, but I can't do that 2 times a week that you need to come in, and because I have to, go home and be with my family, or go home and exercise, or go home and, whatever allows you to recharge.
Exactly.
I don't love the concept of what I derive pleasure from, because it's not pleasure. It's really just recharging and re-energizing, that you really have to just focus on. Like it might not be extremely fun for me to, to always have to go to the gym, but that's what recharges me physically and emotionally. So sometimes you drag yourself to the gym, but then you're like, oh, that was a good idea afterward.
And again, that goes back to the theme of what we keep saying is knowing yourself. I'm an introvert. So when I'm in clinic, it drains me. I love it, but it drains me. And when I'm out of clinic, I just want my alone time. I need my space to like plug in, recharge my battery, get it going again. And I can turn it on when I need to, but just knowing that about myself, and not constantly putting myself in situations where I am going to constantly be drained, then I won't be able to give my full effort with everything.
Absolutely.
We chatted about, we're human. We all have bad days. How do we take care of ourselves as clinicians and not let that bleed into patient care?
I think staying true to our purpose in being there. Our purpose in being there is mostly for the patient, right? Um, at MedStar, we are there for our patients, for those who give them care, for our communities. It's not just me to you in the patient world. We have this greater goal of just really making sure that we're giving quality care to all those people who we interface with. So I think that's the most important thing, is to really understand what our purpose is there. Um, and the way that I do that, maybe not everybody, but you have to have some separation. Our emotional state, what's going on in the background is important to us and we shouldn't ignore it. But at some point, sometimes you do have to separate it. I always bring this conversation up, or my story up, when I talk about this years ago when I was doing the onboarding. So I think we had like 30 or 40, it was a pretty big class of new team members. And I was doing the training with Jill Anderson, who's going to be our future AVP.
Congrats, Jill.
Yes, I know. It's wonderful. I'm very, very happy for her. She's going to be amazing. Um, my husband was getting deployed for the second time to Afghanistan. Um, and he was at the airport, and I called him and said goodbye to him right before we went into this presentation about customer service, by the way. So I gave my whole customer service presentation on the importance of it, and kind of almost like this, it is about the patient and how we project ourselves. And so I gave everybody the insight, like, what did I do 5 minutes before we talked about this? I said goodbye to my husband, possibly for the last time. The reality of it at that point in time, which was 15 years ago, possibly for the last time. And there was different reactions from the crowd, but I asked them, did any of you know that? And they said absolutely not. So yes, this was a little bit in the back of my mind going on, that is my reality, but I'm not going to let it impact what I'm on the exterior dealing with. That in that moment, it's okay to go back after that moment, or know that it is kind of a distraction, an underlying distraction. And just, you need to just incorporate that into what you're doing and saying, I'm okay with this, and focusing on what needs to be focused at that point. Kind of much to the same effect of what I do now when I have a family. It's like sometimes work is in the background and I am trying to have some meaningful time with my family. So at some point, like, I know that's there, and what do I need to make that not be there so that I can focus on my family? Finding that like you said, that balance, but being okay with sometimes it will be in the background.
It's like compartmentalizing. We're really good compartmentalizers as PTs.
Yeah, I think that's a good term, but again, I don't love it because we are one person, so it can't be like shut the door on that. Because if you shut the door on
Temporarily.
that, yeah, I've had therapists who have shut the door on that, and then they get to a breaking point, and there's a floodgate, and it just, everything goes back and forth. So I think there's ways to do it healthier. My sister in mental health field say you have big worries, and it's okay to have your big worries, but you can't let those big worries take over everything.
Yeah. And when I say that, I mean,
Yep.
when our patient's in front of us, they're our number one. And that thing is still
Correct.
in there, but I'm not accessing it until after I'm done and I
Correct.
can use my support system or use my toolbox to manage whatever else is going
Yep.
on. And also, I think it's important to lean on your teammates too. Like if you're having a bad day, let them support you. You don't have to necessarily like, spill the beans and tell them exactly what's going on, but just say like, hey, I'm kind of having a bad day. Like if you see me, like whatever, if I need 5 minutes to just step out for a second, you have my
Yep.
back and you do it.
100%. I mean, that sounds ridiculous, but that's what I love Teams for. Like, something as simple as, like, I have a really bad stomach ache right now. I'm gonna push through, but just if you see me a little down, that's good information for the whole team to have.
So now's a great time to jump into the team conversation. I know both of us work for teams and there's a big network that surrounds us. What does it mean to build resiliency for our team and and make us just better clinicians for our patients.
What does it mean? Like, how do we do it,
Hmm.
or why is it important to do?
Both are good, wherever you want to take it.
Yeah. I think it's really important, number one, to know what our mission is wherever you work. So, like I said earlier, our mission is really to give the best to our patients, their family, their support system, our community. So I think that's number one, is that the whole team is on board with that. Um, Before, see, in January, we just sat down again with my team and said sometimes at an individual level, at a clinic level, your mission might be different than at a corporate level when you're part of a larger organization. Hotels do that all the time. I read some amazing customer service stories about hotels who have just like everybody together created their own mission. And so we did the same thing again. I mean, I've had worked with these people for about 2 to 3 years, but like, hey, let's it's after all the craziness of the holidays, let's see if this is still where we're going. And it was funny because it's like I'd love to say that we developed something mind blowing, but it's like, no, that says it all. Like, this is why we're here. We're here for the patients, their families, the community, and then I always caveat that and us, right? Because we are part of that mission and goal. So I think that's the number one thing when you're talking about resiliency, is like understanding why you're there, so you can always fall back on that. So if something is not going right, or something has changed in a way that is impacting the team, that we can fall back on, well, why is it? But let's look at that. Let's look at that mission. Let's look at the goals that we've created for a clinic and see if they're supporting those. And if they aren't, okay, that is truly not in alignment with what we do. And that's why we don't feel right about it. Kind of separating it from emotions a little bit, because that's in the emotional state, that's really hard. Resiliency is about separating yourself from those emotions, identifying, and then moving beyond it, whether it's dealing with those emotions so that you are okay with the process, or changing that process somehow. So I think it's extremely important for team members to understand the processes that you're doing at your work, the teamwork that you've built, the team that you've built, and have respect for that team structure and that team, the way that we communicate and all those things. So if we aren't doing that for whatever reason, we can figure it out and I won't say fix it, but work through it. So like one of the things that we did at our clinic that I thought was very important was before the holidays, because they're stressful, is talk about resiliency and talk about the new hot topic last year was empathy fatigue. For our patients, right? We give, and at some point we can't give anymore. And that's why it's really important to make sure that we're looking inside ourselves so that we don't get to that point. But I'd also talked about empathy fatigue for each other. It's when we're all stressed for 2 straight weeks because we don't, just because of the holidays, and
Hmm.
it's personal and professional, that we just give each other moments and support each other and move on, and know that that's going to be a little bit difficult, and then it'll get mid-January and everything will be go smooth again.
And this is a little topic I'm just thinking about as you're talking a newer grad looking for their first job, or not even necessarily a new grad, anyone looking for a PT job in a clinic, the importance of spending time there and seeing the group dynamics and seeing how your personality might fit in or not. And if it's too far fetched from where you are, or what your priorities are, what you value, then maybe it's not a great fit for your mental health.
Yes, 100%. And I usually tell people when I interview them, like, if you are getting a good vibe with me, if we're having a good conversation, most of my team that I've built, we have the same rapport with each other. So chances are you're gonna fit in well. But I do agree with you. I think it's important just to shadow, ask questions, even beyond the clinical. Like, what do you like to do? Outside of the clinic, every clinic should be a different team, and then that is one of the beautiful things about MedStar is like we are all different teams. We all support each other. We all support our patient populations and the communities differently. So kind of finding what fits for you. So I'll give you a good example. One of the clinics in Southern Maryland, they love to do like nature walks and things
Hmm.
outside like that. And that's what fills up their cup and recharges them as a group. One of my groups, we like to do some more things in the evening, go out to dinner. And I'm not saying that we do that all the time, maybe once a quarter, or some clinics do more often. It depends upon the clinic. So I think it's important that you're not just looking at clinically what am I going to get from this experience, but emotionally, personally. And that's hard when you're observing, right? But you can ask little questions too, like, what do you like to do for fun? What type of continuing education are you looking for to do? Because that's also important.
I know team things are usually at night, and I talked about how I'm sort of an introvert, and doing those extra things is hard for me. I've really challenged myself a lot recently to to do those things, to step out of my comfort zone and do that, to build that team essence and culture and all of that, because I do value that and it's very important to me. And it's uncomfortable, and I can still do both.
Yeah, it is at the heart end of the day. So I am an interesting blend. I'm an introvert and an extrovert. I'm like almost smack in the middle. So I do I do derive energy and excitement from interacting with people, even like large groups, but I also need my me time. So I hear what you're saying is like it's kind of hard to say, oh, now I have to go out. But then you go out and you push yourself out of your comfort zone and you have a good time and you learn about each other. But on the flip side of things, finding a place where they have a little bit of a balance too, so that, am I doing clinic meeting every month? Am I doing the color personality test? Am I having little team buildings? You don't just have to wait for that one event where you're going outside of work. There's another clinic in Virginia, and none of them want to do stuff out of work. So the clinic director has really heard all those comments and those personalities and said, well, let's do like little things for each other, and that's what works for them. So I think it's important that you find a place that really works for you.
Definitely. This has been a great conversation. And as we start to wrap up a little bit, I want to know, what are your 3 top tips to improve mental health as a clinician?
I think that the biggest thing is building your toolbox of resiliency. Just like as a therapist, you have lots of different techniques. Build that toolbox up. Know what it and is in other people's toolboxes, so you can rely on those. That's the biggest thing. And if that means I find out about it through work or on my own, however you do that, but understand the concept of resiliency and change and being right with that. I think giving yourself whatever time you need to reflect on the day, what's going on, your work-life balance, however you reflect on it, it's extremely important. When with patient care, we tell them to reflect on their experience, their rehab, their pain, and it's important for us to do those things with ourselves. And I think the third thing, which I said from the very beginning, it's okay not to have all the answers, but it's okay to be not okay, basically. But having the resources to work through those not okay times.
Definitely. What is your favorite quote? We like to end our podcast.
Yeah. So my favorite quote I saw years ago, and it's an unknown, so it's not a famous person, but a big shot is nothing more than a small shot that keeps on shooting. Yeah, it really resonated with me all those years ago when I started the military, and I'm 5 foot nothing and had to compare myself even physically with, taller, bigger people. So, just physically, the physical component, it just made me laugh. But, internally, it's just been something that has kind of brought me along my career. Just like keep on going and shooting for the path that you want and the path that is mutual as far as the team members and whatever your career is, wherever you want your career to go.
It's great. Love that one. I have not heard that one. I've heard iterations of it, but yeah. That's a great quote. Karen, where can people find you? Where are you treating? What clinics are you directing?
Sure. I'm a regional director. I direct technically also the clinic director of Brandywine MedStar Health Physical Therapy in Brandywine, Maryland. And I also oversee our Clinton site in Maryland, who is also ran by Jesse Smith, our clinic director. So, but I also bounce around the network a little bit. Happy to have people come and join us in Southern Maryland. It's a beautiful place. Just putting a plug in there. Only about 20 minutes from DC and 40 minutes from Baltimore.
Love it.
But it's been a ride. It's been a wonderful experience to have this incredible network and incredible support system, and allowed us to grow so much as professionals and personally too. So I really appreciate the time and the thoughtfulness that you had during this month to think about me personally. So I do want to say it's been a pleasure talking to you, and I hope if anybody gets a nugget of information from our podcast, then I'm happy. That makes me happy.
I couldn't end it any better than that. So we're good. Thank you, Karen. So thank you for your time.
Absolutely. Have a wonderful day.
Thanks for listening to the Let's Get Physical Therapy podcast. Be sure to subscribe to our podcast and follow us on Instagram at MedStar Health PT. If you've enjoyed today's episode, please give us a 5-star rating and leave a review so we can reach more listeners just like you. As always, we appreciate your time and hope you join us for our next episode.